Stellenbosch University epidemiologist Dr. Joe Barnes is with us tonight to talk more about the cholera outbreak in Gauteng, predominantly around Hammanskraal. A very good evening to you, and thank you so much for your time. You've argued that what is happening here, as far as the attempt to try and locate the source of the outbreak at this point, will pretty much mean very little. Why is that?
Good evening to you and to our viewers. I and other colleagues have been warning for a long time that South Africa is sitting on a time bomb because of the very poor water and sanitation services in many of our towns and cities that are delivered, and not only to the poor but particularly to the urban low-income areas. So I'm in a way not only disappointed but embarrassed that the richest economy in Africa should be so vulnerable to a disease that has been eradicated in the higher income parts of the world almost 100 years ago.
And it comes down, doesn't it, Dr. Barnes, to the issue of hygiene, the issue of infrastructure around water predominantly, even though we're still waiting for confirmation on where this exact outbreak came from.
You know, that's a wild goose chase. Yes, it is called waterborne disease in the handbooks, but the first person who suffers from the disease excretes millions of these organisms in that profuse watery diarrhea. And after that, because of extremely poor handling of sewage, running down the streets with overflowing drains, they are now in a way hunting a wild goose chase, because the disease is already in Hammanskraal, for instance. To now go and look at the water sources that are being delivered today, the cases that are there got infected last week, or the week, or even perhaps even earlier, because not all of them sought help at the hospital. So in a way, if they find, and they're going to find, that the water is now clean, that doesn't mean that everybody's hands are clean who had been working on this situation. It simply means that they are looking for it in the wrong place now. And I'm so concerned that they are looking for the source, which they probably will not by now find, instead of cleaning up as fast as they can all the sewage that's sloshing around in places where they shouldn't, and see to it the water chain doesn't end at the water tanker. People come and fetch water there in buckets. They put the bucket in their home with a scoop of some kind, a jug next to it. The next guy who puts the jug in there to scoop up some water out of the bucket, who has dirty hands and puts his hands inside the bucket, dirties the rest of the water. So providing clean water by water tanker is not by no means the last of the story.
Mm-hmm. And so just on that, Doctor, what you're basically saying is, for instance, let's say the first person who may have come into contact with the contaminated water and then passed on the various other particles to other people in that area, it would have taken about a few days for the person to basically become symptomatic. So it would suggest, by all logic, that the original source may now be very different or even cleaned. And I wonder, if that is true, what it means for the tests conducted by the city of Tshwane, where it then said that it found no traces of cholera in its piped water earlier this week.
Well, you know, there has been great lapses in water testing, and the department, there's been a long history of potable water provided to Hammanskraal that is not fit for human consumption. It has been like that for at least a decade. So to say that the recent water has now been clean it's just one of the many factors of the fact that the place is in such a shambles as far as service delivery is concerned. I am of the opinion that the chances are better that the cholera organisms came, as I said, came walking into Hammanskraal, because it takes from half a day to 5 days before the symptoms develop. So somebody may have got it somewhere, picked it up somewhere else, and relocated or came visiting Hammanskraal, left it behind, and the original person may not even be there anymore. But the conditions for cholera were so conducive in Hammanskraal, and my big fear is that there are many, many Hammanskraals in South Africa. We have so many vulnerable communities because of poor services, and it's an indictment on our country that this has been going on for so long, despite so many warnings that basic service delivery is one of the most important things. We simply cannot afford another massive outbreak. We are barely staggering out of the previous one.
And it's not a coincidence, is it, Doctor, that these many Hammanskraals you're referring to are areas that are predominantly poor?
Yes. So those people are particularly vulnerable. They are malnourished. Many of them have other health conditions on board, such as HIV positive or TB positive or many other diseases. They live in what you could really be honestly calling squalor. It's not clean. They have very bad solid waste removal, and many could use a chamber pot or container of some kind when there is no toilet available or the toilet doesn't work, and then they empty that into the nearest solid waste container. So the solid waste is also suffused with sewage, and we really need to turn the situation around. I pleaded almost 15 years ago with a town councillor in a low-income area that I work with to please help us get some more toilets in that area. And he looked me straight in the eyes and he said, there are no votes for me in sewage.
And what you're talking about there is just the neglect suffered by poor communities where water and sanitation services are so poor that even if people try to clean up and keep the area clean, I mean, in Hammanskraal, when our reporters were there this week, for example, people complained that blocked toilets where sewage was flowing had not been attended to despite them logging calls.
I totally understand and agree with you. You cannot inspire people to pick up litter that block the sewage pipes and then the overflows occur, or that you can inspire people to keep the area clean and not put foreign objects in the sewer system, if there is even one. When the service is so poor that they don't even understand that it's going to make a difference. You can only teach people how to keep the system properly going if they can see that it actually helps. So, and I'm concerned also that I've not yet seen, and you may have, but I have not yet seen large information campaigns in those areas to say, this is what an oral rehydration solution is. Please make it up and feed it to people who have chronic watery diarrhea. And it may help them to stay out of hospital, and it will certainly, because you do not need to die from cholera unless you suffer from other crises as well. You can just stay rehydrated. So I don't see any information campaigns about staying clean, washing your hands, or anything like that. And by now, as you say, we've had 22 deaths in the country in more than one place. Where are the authorities that could inform the people what they can do to help themselves? I don't see it. It's another big area that we are simply falling down. We don't keep our communities informed.
Dr. Jo Barnes, good to speak to you. Thank you so much for your time tonight.